Okay, so causes of vitamin B12 deficiency. So poor intake is possible. An example of that would be an alcoholic, where you're just not eating other food sources, right? You're going to be mineral and vitamin deficient. A very strict vegetarian diet or a vegan diet can result in vitamin B12 deficiency because we get B12 in meat products. Okay, malabsorption of the B12. Okay, so if I mentioned before, if you have a condition of your distal ileum, by far the most common is Crohn's disease, well, everything's getting there. The B12 is getting there, that's attached to the intrinsic factor that was produced in the stomach. But then they get to the distal ileum and it can't get in because of the disease there. So that's malabsorption. Okay, lack of intrinsic factor is a very specific type of B12 deficiency that we call pernicious anemia. So pernicious anemia is a lack of intrinsic factor leading to B12 deficiency. And that can come from post-gastrectomy, meaning you've had surgical removal of your stomach, or with the aging process, you can get atrophic gastritis. And both of those will lead to pernicious anemia, lack of intrinsic factor. Okay. The ileal malabsorption is what I just mentioned with Crohn's disease. And if your Crohn's disease is bad enough, sometimes that section of the bowel needs to be resected and it's surgically removed. Well, B12 is not going to be absorbed there if the ileum is no longer present, right? So it's either Crohn's disease or the lack of a distal ileum because it had to be resected because of Crohn's disease. Okay, so think of B12 as needing this factor that's produced in the stomach, and then they migrate together through the gastrointestinal tract and get absorbed into the blood that goes to the liver, and that happens at the ileum. Okay, so if you have a lack of intrinsic factor, that's pernicious anemia. If you have a disease state at the ileum, such as Crohn's disease, or a malabsorptive state, that's going to also lead to vitamin B12 deficiency. Okay, so remember, vitamin B12 deficiency can be from a dietary lack of B12, it can be from missing part of your ileum, but now we're going to talk about a particular type of B12 deficiency, pernicious anemia, and that is due to lack of intrinsic factor from the stomach. Okay, so don't just add it as one cause of a vitamin B12 deficiency. Okay, so intrinsic factor is made in the gastric parietal cells. So anything that causes reduction of the parietal cells to produce intrinsic factor will lead to pernicious anemia. Okay, and that is stomach surgery, the aging process leading to atrophic gastritis. Okay, anything that's harmed the stomach and reduced intrinsic factor. And that is the reason why we need to give these patients injectable vitamin B12, typically on a monthly basis, because we can give them as much B12 as they can possibly eat. But if you don't have intrinsic factor from the stomach, you're not going to absorb it. So the way we get it into a patient with pernicious anemia is by injectable, so IM injections of vitamin B12. Okay. What about someone who just doesn't eat much foods with B12 in it? Relatively uncommon, but very strict vegans, this can happen over a long period of time because you have many months of B12 vitamin that's stored in your liver. So you have enough to last for months. Okay? So now we can just encourage them to take nutritional vitamin B12, right? You can take it as a supplement because they have intrinsic factor being produced in their stomach. So they don't need the injectable form of B12 like you would in pernicious anemia. Okay. Okay, so B12, vitamin B12 is in an assortment of foods. And as I mentioned, we don't need tremendous amounts of it, and we're also able to store it in our liver, right? So it comes in meats, poultry, shellfish, eggs, and dairy products in general. And remember, I know I'm being repetitious here, the subsection of vitamin B12 deficiency in the bloodstream that's caused by lack of intrinsic factor we call pernicious anemia. Okay? So if we're talking about vitamin B12 deficiency in general from any cause, well, it's going to lead to a megaloblastic anemia, large red blood cells. Okay? Okay, and here's what the large red blood cells look like on a blood smear. So because the B12 was required for red blood cell maturation and division, that didn't occur, right? So whether it's a vitamin B12 or a folate deficiency, it results in these megaloblastic or macrocytic red blood cells because both of those vitamins are required for maturation and division, cell division of the red blood cells. Okay. Okay, so let's look at some clinical manifestations of pernicious anemia. Or in actual fact, we can just say clinical manifestations of vitamin B12 deficiency. Okay, so, but by the way, the most common cause of vitamin B12 deficiency is pernicious anemia. Okay, and it is quite common as people get older because their stomach lining becomes atrophic and it doesn't produce as much intrinsic factor from the parietal cells. Okay, so the first part in terms of clinical manifestations is just the symptoms of anemia, right? The fatigue, the weakness, the increased heart rate, the pallor, shortness of breath, dizziness. Those are all symptoms of any anemia. Okay, so now we add in the lack of vitamin B12. And what's that going to do? Okay, well, B12 is required for proper nerve function. So patients can develop a peripheral neuropathy where they can get numbness and tingling to their fingers and toes. Okay, that can be a symptom of B12 deficiency. Okay, we're not talking about folate here at all. We're just talking about B12. Okay, what about central nervous system symptoms? Well, patients can get memory loss. They can get depression. They can develop ataxia, which is off balance when you're walking, an ataxic gait. Okay, so this is one of the reasons why we always do a vitamin B12 in a patient that develops with or who presents with the possibility of dementia. Okay, because that would be a very easy fix if their dementia was based on a B12 deficiency. Okay, so it's an easy thing to check. All right, most of the time it's normal, unfortunately, and the dementia is from Alzheimer's disease, but we definitely check a vitamin B12 level if someone presents with memory loss and sometimes even depression as well. Okay, we also check, by the way, a thyroid hormone because lack of thyroid or low levels of thyroid in your bloodstream can lead to memory loss and depression. Okay, so those are two tests that we often get, a serum B12 or a serum vitamin B12 and a thyroid hormone test to make sure that that's not the cause of their symptoms. Okay, so when we do a blood test, we can definitely check serum folates, and we actually order a serum red blood cell folate and a serum vitamin B12. Okay, and that will give us a level in their bloodstream. How do we treat a B12 deficiency? Well, we spoke about this. If the B12 is able to be absorbed because their stomach isn't the issue and they have intrinsic factor and they don't have Crohn's disease that's blocking the absorption of the B12, then we can give oral vitamin B12. If they're not making intrinsic factor from the stomach, or they've had their stomach removed, or they have Crohn's disease, or something that's stopping absorption of the vitamin B12, then it's monthly injections of the B12. Okay, so folic acid deficiency. So folic acid is vitamin B9, again, required for normal maturation of the red blood cells, just like vitamin B12. Folic acid is water soluble. It's not stored in the liver. So if you don't get proper amounts of it in your diet, there's nowhere for the body to store it. So that's why you can become folic acid deficient by a very poor diet, okay, that's lacking folic acid. Women take it not only to prevent a megaloblastic anemia, but also to avoid neural tube defects during pregnancy. Okay, so pregnant women, it's actually avoiding megaloblastic anemia and also preventing neural tube defects. Okay, and replacement is just oral, right? So if you have a folic acid deficiency in your bloodstream, it's just oral replacement. It's not injectable. Okay, let's do this question together. So a patient with sickle cell anemia is admitted to the labor and delivery unit during the first phase of labor. The nurse should anticipate the patient's need for supplemental oxygen, fluid restrictions, blood transfusion, delivery by cesarean section. So in sickle cell disease, when you're stressed or you're potentially hypoxic, the cells will sickle, and then they don't get through the capillaries to different organs very well. And that's what causes ischemic pain to different parts of the body. Okay, so, and we definitely don't want someone who's delivering to have their red blood cells sickle more. So supplemental oxygen would definitely be expected. Fluid restriction would not be expected at all. A blood transfusion isn't necessary unless the person's severely anemic. And delivery by cesarean section isn't necessarily the case. So it would be supplemental oxygen to try and prevent the red blood cells from sickling.